Hello. I'm joined here today by Richard Tromp, Director of Operations for Sunstar, and Chief Stefanska of Safety Harbor. And we wanted to talk to you a little bit about COVID-19. I'm sure you've heard a lot in the news about COVID-19, and I'm sure you've seen that there's been a few medical control directives related to this. What we want to do now is update you as to the situation and what we're doing to keep you safe out there as you take care of our patients. So first, there have been 3 confirmed cases in the Tampa Bay region as of the filming of this video. One of those cases does not have a known travel history. 2 of them are related to international travel. Additionally, although not a lot of patients have been tested so far, very soon we expect to see many more cases as testing ramps up throughout our community. As a result of this and some updates to the CDC case criteria, it's time to alter the guidance that we gave you previously and include a little bit more about how to keep yourself safe as we take care of our patients. Worldwide, there's now roughly 100,000 confirmed cases. Over half of those patients have already recovered, but several thousand of them, 3,000 and change as of this filming, did pass away. The people at highest risk are older folks, particularly those with comorbid conditions involving the cardiovascular system. And if you notice out in Seattle, where there's a significant outbreak right now, many of those patients were from a single skilled nursing facility. Interestingly, young patients seem to be at less risk from the virus, but may asymptomatically carry the virus or possibly even transmit it. Now, asymptomatic transmission has not 100% been confirmed right now, but it does sound as though it may be a possibility. With potential community spread not associated with travel or contact with other known cases, and with the fact that the transmissibility, whether or not somebody can be contagious when they don't have symptoms, it's now time to take some additional steps to protect our workforce. So, with that, we are updating the respiratory isolation precautions and the possible COVID-19 speed note. The dispatchers are continuing to ask questions about travel history as well as contact with known cases, and if they identify a person with fever, respiratory illness, and either travel to a place where there's a known outbreak, that's 5 countries currently, or contact with a known case, they will put the COVID-19 note in the CAD system. If, however, they have a patient with viral respiratory illness, that's fever, cough, difficulty breathing, and there is no known contact history or travel history, they will put the regular influenza speed note in. If you see the influenza speed note or the COVID-19 speed note, you need to take extra precautions. And that means not just a surgical mask. We're now going to ask you to use an N95 mask, face shield, and goggles, along with a gown, cap, and gloves for any patient who meets either one of those criteria. We will not transport a known COVID-19 patient without taking express precautions and coordinating that through myself and Craig Hare. In the meantime, the new medical control directive lays out 3 options to keep you safe in terms of PPE you may use, and lays out exactly when those should be used. Additionally, we want to limit the number of personnel who are making contact with a patient. In the new medical control directive, you will see a table that lays out how we want to approach these patients to get the lowest number of people close to the patient while we do the initial assessment.
Sure, so typical fire department Sunstar responses that are happening today and that happened yesterday, we're still doing those at this time. So when a 911 caller calls 911, the call taker is moving them through the process, and all your responses are remaining the same. But as Dr. Jameson said, the call taker is asking very specific questions to help us recognize suspect coronavirus cases. So this is where we really need you all to be watching your MDC screen for the COVID-19 alert and or the respiratory isolation precaution alert. That's where we need you to really focus on the BSI and the PPE that's mentioned, that's required in our protocol. By ensuring that our personnel are wearing the right PPE, we're going to dramatically reduce the need to quarantine our first responders, which is very important to maintaining our workforce. So Rich, why don't you tell us what happens once we all arrive on scene?
So typically in our system, the fire rescue unit will arrive on scene. Now, if we have one of these speed notes in the notes that you see on your NBC, the paramedic is going to don their PPE. The other crew member is going to assist that paramedic, but the paramedic will go to the patient's side. They'll have a disposable BP cuff and the stethoscope. They're going to make a quick determination if we're going to treat and transport. If we're going to transport, the Sunstar ambulance will come in behind them. The paramedic on the ambulance will now put on their PPE. So those are the two individuals that are going to be taking care of the patient, loading them onto a stretcher, putting them in the back of an ambulance, and taking them to a hospital. We got to remember that we notify the hospital as early as possible so they can be prepared. But in the meantime, the support staff or other members that are there from the fire rescue departments and from the ambulance company, you're going to be supporting those two paramedics with equipment if necessary. You're going to have your N95 mask on, your eye protection also, but stay away at a minimum of 6 feet. That is the general rule of thumb that they're using right now for the airborne and the droplet protection. The ambulance operator or the rescue truck operator, you're going to have an N95 mask on and goggles on, and you're going to drive the vehicle to the hospital. You're not going to participate in patient care. That way we can keep the cab and the patient compartment areas separate. You get to the hospital, the two paramedics again will unload, making sure that we're extra safe. Remember, you're going to have on eyewear, you're going to have on a mask, you're going to have on a gown that's protecting you, booties. These are all things that could limit or inhibit you from seeing the stretcher catch. Make sure you have somebody being a safety officer watching the unloading of that stretcher so the patients come out safe and we can operate them well. Bring the patient inside. After you move the patient over, you will come back outside. You're going to throw away all the disposables. You're going to decon the stretcher with the hydrogen peroxide spray with a 1 minute wet time, and then wipe it, and then you're going to spray the back of the patient compartment. After that is done, the two of you can don or doff your equipment at that time, helping each other take off your PPE. Throw it in a bag, and then it'll be disposed of in the trash properly there at the hospital. Nothing goes back to the station, nothing goes into the ambulance at that point. At this time, you have done everything you can to protect yourself, and that's what we really want to talk about, is making sure that all the paramedics and EMTs in our system are protected to the best of our ability, and we want you to use the equipment properly. Don't overuse it, but don't underuse it. We really have to make sure that we're using the right equipment the right way when we're at the patient's side.
So it's also important that we keep our equipment clean, that we keep our apparatus clean, that we keep our facilities clean. So I know I speak on behalf of Richard for Sunstar about ensuring that we're deconning the ambulance, we're deconning our equipment on the fire apparatus, and that we're being extra vigilant on our station cleaning those kitchens, bathrooms, hard surfaces. We're not bringing the EPCR into the station to do our report.
Nope.
That we're always washing our hands and we're watching out for each other. So if we're sick, stay home. We don't want to spread this throughout our workplace.
Yes.
Yeah. So just one or two other things about the clinical care of these patients. Please go ahead and initiate an online medical control consult if you believe you're dealing with a patient that may have COVID-19. If you have any questions about whether or not they meet criteria or what treatments you might want to do or defer to the hospital. In general, aerosol generating procedures, that's high flow nasal cannula, oxygen, that's CPAP, suction, intubations, BVMs, should all be deferred unless absolutely needed, and really performed with full PPE in place and the fewest number of clinicians necessary at the patient's side in the immediate treatment area. We will be updating you shortly with further steps that you can take in terms of filters and other strategies to minimize aerosolization. But for right now, if the patient doesn't really need to have that nebulizer right now, we may want to go ahead and defer it. And please just call the online medical control physician for guidance as to what needs to be done or what can be deferred. Please also make sure that you write the words suspected COVID-19 or confirmed COVID-19 in your PCR when dealing with these patients so that we can make sure we have an idea of just how many we're seeing. And please use the isolation precautions taken intervention in your ePCR to document that appropriate PPE was utilized and enter the number of personnel who were actually donning their PPE in the intervention qualifier in the ePCR so we can ensure that everybody's being safe and so that we can help manage the supply of PPE. The biggest challenges I think we're going to have over the next few weeks is maintaining supplies of PPE, which means we have to be judicious about when we use them, but also maintaining you all in a safe manner so that you can continue caring for our patients, which means you need to use the PPE appropriately, not be wasteful with it, and make sure that you keep yourself healthy. We do not want to get to a point where many people are out sick all at once. If I had to predict, I'd say there's a good chance that COVID-19 will make its way through our community in the near future. And I think there's a good chance that some of us may even catch COVID-19. Most of us who aren't particularly elderly or have significant underlying medical diseases will probably have a fairly mild course, a cold, a flu, that sort of thing. But this is something that's going to be a challenge for us over the next few weeks and few months. We, as a team, will continue to provide you as up-to-date information as we can. I talk every single day with Dr. Cho from the health department, and we are keeping as best a tab on the situation as we can, and we'll continue to update you on an ongoing basis.